Before I invite Ambassador Ray on screen to join us from New York, we would like to introduce an informative and relevant case study from Atlantic Canada about Nova Scotia's vaccination rollout this spring. It will provide some insights into matters of public trust and collaboration in keeping with our theme this evening. So allow me to welcome Tracy Barbrick, Associate Deputy Minister of Health and Wellness for the Government of Nova Scotia, who will speak to PPF's case study on Nova Scotia's immunization program management and outcomes of this vaccine rollout. Welcome, Tracy.
Hi, everybody. Thank you so much for having me, and thanks for the introduction, Ed. I have a couple of slides here, but before I pop them up, I just wanted to generally say thank you so much for having us here. Nova Scotia's vaccine rollout has been a source of pride for the majority of the province. It's been an amazing time of community coming together and doing what was needed to navigate this pandemic. It truly has brought out the best in people, and it's more a story of heart and community than I think it is of sort of traditional policy work. I'm going to talk a little bit about our decision-making structure because it mattered in terms of agility and being able to move quickly. A little bit about our design features and outcomes. So that's going to all happen in 5 minutes. So bear with me. We're going to go quick. I'm going to bring up a slide here. If somebody can confirm that they can see it, that would be great. Okay, perfect. I see Jonathan. It might be small on the sort of wrong. Oh, there we go. Okay. And now we're going to spend the next half hour walking through this very complicated chart. Aha. So all this wants to point out really is this was our decision-making structure. So our key partners in this were sort of our delivery arms through our Nova Scotia Health Authority, the Pharmacy Association of Nova Scotia and all the pharmacies, our Doctors Nova Scotia organization and our physicians, the Can Immunize team that was our central booking agent, our call center called Emergency Management team, as well as our Canadian Armed Forces folks and all kinds of stakeholders that represented traditionally underserved communities. So we had the offer from the Canadian Armed Forces of a team to support us. We readily accepted that offer, and that was a game changer for us. So really what this shows is a very integrated decision-making process that truly reflects the level of collaboration. It was co-design right from the beginning and really digging in together. There was just no time for protracted decisions and organizational design and charts and sort of turf war about who owned what. We really needed to dig in fast and hard, and there was a single point of decision making, and me as the Associate Deputy Minister that was responsible for the rollout. And it really did bypass all sort of traditional approval processes that we are all used to in government, and it allowed us to be very agile. So it was collaboration right from the get-go. So rather than talk about design features alone, I'd like to talk about the principles that underpin this work for us. So some of you may have seen our Dr. Rob Strang that's been really the guiding beacon through what's been a very rough nearly 2 years for all of us. And we decided in the very beginning days that we would underpin this with principles. So one of those was accessibility. I'm going to talk a bit about each of them. One of them was accessibility, reliability, equitability, and transparency. So we spent a little bit of time making sure that we knew what principle we were going to work from, not in the protracted way that can sometimes happen, but in a overnight, these are the things that are going to guide our decisions no matter what happens. And we really dug in with those principles. So in the spirit of accessibility, we decided on day one that Nova Scotia would have a central booking system that allowed any Nova Scotian to go into one location, either on a 1-800 phone line or an online booking system, and everything would be in one place. So no scrambling around making phone calls to hundreds of different locations. It would be a very accessible tool for all. We took criticism on the front end for that because it meant Nova Scotia was a little slower out of the gates. And if you had watched the vaccination rates in early days, Nova Scotia definitely, I was on the news a lot speaking to why we were slower out of the gates in early days. What we knew was that was going to provide an accessible experience for Nova Scotians. And in the end, it would make us faster and more agile, which it did. We also leaned into our community pharmacies so that every pharmacy in our province would have vaccine available to people in the community, so it was accessible to them as close to home as possible. We also made decisions that drive-throughs would be part of things earlier for those with disabilities or for those whose family members had an auditory or sensory disorder that made going into large mass clinics very difficult. And we would have a homebound program for people that just could not leave their home. So that accessibility piece underpinned the design. The second piece was reliability. We committed from the beginning that we would follow the NACI guidelines to the letter. We never departed from them and still haven't. That meant that we leaned in heavily to an age-based process, which also took tremendous criticism because we didn't provide as many sort of identifiable occupations where people would get primary access. We really felt that the most efficient way to get the province vaccinated was using their Nova Scotia health card or their birth certificate if they didn't have a Nova Scotia health card, so that we could work through the ages very efficiently. We also only released appointments to the public when we knew the vaccine was loaded on a plane. So we didn't want people to have the experience that they had to be anxious and aggravated by having appointments canceled. So we decided reliability would underpin that. And finally, we decided that we needed people to have trust in our system by making ourselves highly available. So Dr. Strang and myself did really almost daily news releases in the early days, and then we were available to the media and technical briefings routinely so that we were constantly putting information out. The third component of this was equitability. So in very early days, we started to work with all our community partners to ensure that our traditionally underserved populations were served. So we worked with our Association of Black Social Workers and our Health Association of African Canadians, all of the First Nations communities, our adults with disabilities and their representative sector groups, our Muslim communities, shelters, and focused all of our communications on very inclusive advertising. So that too gave us a little bit of criticism in early days, because we did that early out of the gates under the principle that we would not leave any Nova Scotian behind. So that principle held true all the way through. And finally was transparency. We provided real-time data to the public from day one. They could see our immunization rates, geographical coverage rates, almost to the postal code level, so that people could see what was happening in the community around them. We started reporting adverse events within the first 2 weeks, and breakthrough cases. We were the first province in the country that started to report our breakthrough cases. And on top of that, we were very committed to informed consent. So when we started to see some identifiable triggers out there around AstraZeneca, myocarditis, and pericarditis, we were constantly updating our consent documents and messaging so that people could make a decision based on the information that was available to them. And again, our communication strategies through this really relied on science. So we had a series of ad campaigns called Get the Vax, Know the Facts. And we had experts in the field that were scientists and physicians in community that were speaking directly to the public in a very user-friendly way. So all of those things from what guided this process for us really nested back to those 4 principles. And you can see that part of that built an awful lot of trust with our Nova Scotians, that they would get what they needed to make decisions and we wouldn't hold back any information. Dr. Strang was relentless on that. Every time we started to get any kind of a signal that was a concern, we would have a press release or a news release or make ourselves available to media within 48 hours. And I think that at the end of the day, really held us up through tough decisions. So when we were really digging in for some tough things to resolve, it always came back to those 4 principles to help us make those decisions. So the result of all of that was, I think, probably what some of you have seen. Our Nova Scotia vaccination rates are some of the leading rates in the country. So we're right now, this was yesterday, about 78% of Nova Scotians have been fully vaccinated. You'll see that those with 1 or more doses up at 83%. So we expect they'll follow through on the second doses. The national average is 73%. So that is a very difficult final mile. The difference between 73 and 78 is quite meaningful for epidemiologists. And we're second only behind a couple of countries. Singapore, Spain, Iceland, the Cayman Islands are all about 80%. We're very, very close behind them. So I think, given the theme of this, this time together, the story that Nova Scotia has had is very much anchored itself back in those areas around collaboration and trust. So I'm not sure where I am on my 5 minutes, but I'm going to wrap up because I think you have a tight agenda. So thank you all very much. I'll look forward to the panel discussion later.
And thank you very much, Tracy. That was really a fabulous inside look, which we appreciate. And I think we also should appreciate that there's far more complexity attached to something like a vaccine rollout in the middle of a pandemic that wasn't planned for years and years than we might appreciate. And I think also it probably speaks to when you have greater social cohesion in an area, it's easier to implement or fewer obstacles to implement policy.